I think this is a year of the nurse and midwife we didn't expect. It's been amazing to highlight what we do every day, and even with a healthcare crisis, we're still doing what we do every day.
We have to be that strength for our patients, and we really just keep going and doing what we do and putting on a brave face. So I think it just shows the resilience that we have as nurses each and every day.
COVID-19 has changed my view of the role of nurses and midwives in healthcare, in that it's just increased my admiration for their dedication and professionalism. We've had nurses volunteering to take on critical care roles, which some people have seen as high-risk nursing roles in a pandemic, and yet we still have people queuing up to upgrade their skills in order to take on these positions. And that, to me, is just amazing.
For me, it's showing the resilience nurses have during these times and the professionalism they have.
I'm a credentialed mental health nurse, and I think one of the things that nurses do have is that real capacity just to adapt.
We've got a lot of young patients that were having to juggle trying to find who could look after their kids with the COVID situation, and then get themselves into the hospital. So having someone being able to go out and visit them in their home to give an injection or to take a blood test has made a huge difference.
An important part of that process is ensuring that our patients feel comfortable and understand what's happening to them and with them and for them. And further to that, how to keep their loved ones safe whilst there's a pandemic, a global pandemic happening.
Who predicted that this would be the year of the nurse and the midwife? You know, it's quite ironic in a way, but, you know, maybe because of this, it makes people realise, you know, the dedication to their role.
Nurses are an even more integral part of a patient support network. During this time, we're there for them, and they need the extra comfort and support when their family and friends aren't able to be there with them.
I was able to see the management side of things as well as to what goes into executing COVID responses, and you know, the work put in by our team here was just exceptional.
I've also thought a lot about the teamwork and the way St John of God's have come together. So I haven't felt alone, and I've had plenty of support to get things organised.
The response from the nurses, it really has heartened me.
It was sort of very different experience when we initially got here. Obviously, you got to do your temperature testing and stuff like that. But the minute we went through that process, it was like there was no COVID-19. It was relaxed, and the staff were happy and very professional, and made us feel like, you know, it was business as usual, and more importantly, we felt extremely comfortable.
We are our patients' advocates, and we need to make sure that their safety and health is paramount, and that we look after them and care for them.
The current crisis has just reinforced that we do a difficult job, but we do it with a smile, and we do it with the patient's best interest always at heart.
I feel proud to be a nurse and midwife. I think we're a role that worldwide is essential, and we love what we do.